The Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
Today it's an incredibly important topic, if I remember it correctly. And it's about the difference between dementia and brain fog, etc., how to tell the difference, why it's important. Very privileged here to have this incredibly important talk on the difference between dementia and brain fog, etc. And this is Dr. Kriththa, who's going to give this wonderful talk. She's been with Bangkok Hospital for 4 years. Handing over to Dr. Kriththa.
Hello. Good morning, everyone. First of all, I have the game. I have the game for some people don't want to check with the hospital, but I would like you to check yourself. I will tell you three words, and you remember. And after that, we play the game. The three words is the one is a red color, red. The two words is the banana, and the third is the mountain. You can remember? Red, banana, and mountain. Okay. I will ask later. So now I will ask you to think of the word. And you count the word. That the word that have to start with the A letter. Please think of the word and you count how many words that you can think. Okay, start please. In 1 minute. I would like to know how many words that you can think of. The word that start with A letter. Yes, you count. How many words? How many words now? Okay. Okay, time out. How many words that are, if somebody count less than 11 words that you can think of, maybe you have a memory. We call the memory problem, we call the word finding difficulty. Have someone think of less than 11 words that start with the A, the letter? Okay. It's okay. So, do you remember the three words that I asked you before? Oh, good. If you can recall, you had a good memory. So we start now. Okay, we will talk about the memory problem because it's I think that the brain is the most important organ in our body, because if we have a problem with the brain, the life quality is not good. That's why today we talk about the memory problem, because the memory problem is not come from the Alzheimer only. We have the lot of the problem that cause the memory loss, and I would like you to know about what exactly the problem and the risk factor, and because if we know that what we are, we can prevention, we can treatment, and we can slow the progression of the memory loss. For for the cognitive impair, some problem that can reversible, but some problem that can slow progress, right? The spectrum that we will talk today is the attention deficit. One is attention deficit. The second is anxiety related, the cognitive dysfunction. Third is the brain fog. Fourth is the mild cognitive impairment. It's very important in the fourth because it begin to have the problem in the brain. And the fifth is the dementia. Dementia is a problem already. First of all, we start at the attention deficit. That the attention deficit, we have to know that when the people will record the memory something, we have to attention first. And the second is, if we have the attention, it will encode in our brain and go to be the memory. If we have no attention, the thing that not encode in the brain, that's why we easy to forget. And why we have the attention deficit? Someone have a polypharmacy, such as some antihistamine, sleeping pill. Anybody have to take the sleeping pills? No? No problem with the sleep at all? Oh, very good. And some patient, somebody have a depression now? Depression from your wife? No. Oh, very good, very good. And have some patient, somebody have a chronic pain, or somebody have sleep apnea. You know, do you know the word of sleep apnea? Sleep apnea, someone don't know that they have a sleep apnea, because sleep apnea your wife will tell you have sleep apnea. Some people have do you have the snoring at the night time? Sometime, right? Maybe you need to do the sleep test, because if you have the sleep apnea, it's very important because your brain have a lack of the oxygen every night. Very important because it can cause the stroke in the future, and it can cause the dementia in the future too. The attention deficit is over now. For the attention deficit, and for the treatment is very easy. We can treatment for, if you take the pharmacy, you maybe less of the pharmacy that you take for the medication. If you have depression, maybe you have to find out the problem of depression, or go to see the psychiatrist. And if you have the chronic pain, you have to get rid of the pain. And if you have the sleep apnea, maybe you need the machine to help you. Or you lose your weight, the sleep apnea will be better. The second problem with the memory, we call the anxiety. The anxiety is make the hormone we call the cortisol. The cortisol will have a suppression of the area of the brain we call the hippocampal area, not the hippopotamus, right? The hippocampal, we have the hippocampal is in the temporal lobe of the brain. The job of the hippocampal is to record the new memory. If you have high the cortisol level, the hippocampal suppression, you cannot remember the new memory. We have the a recent memory impairment. And you have the a sleep fragmentation. The sleep fragmentation, it means that you sleep in the 10 p.m., right? After that, 2 a.m. you wake up and cannot sleep at all. Maybe sleep again after 5 a.m. That is a sleep fragmentation. It's not sleep, have a good quality of sleep because you have the anxiety. It's impair the encoding. Encoding, you remember? We have to attention first and encoding and go to the memory. If you have the anxiety, it's impair the encoding. It cannot encode to your brain. But it's good luck that this situation is treatable, is reversible to the normal if you get the anxiety out. If your wife make you anxiety, maybe you have to tell her, okay? tell your wife if you feel anxiety, and you have more anxiety that after that. The third thing is the brain fog. The brain fog is the common. The brain fog is it's fluctuation. Today we have the clouding of the thinking. Tomorrow maybe it's better, and today and the day after tomorrow have the clouding again. It's the fluctuation, and it's like a subjective more than the objective. Mostly after post-COVID, we have lot of found it's a brain fog, and as the medication too, especially the pain medication as Tramadol or did anyone have tried Tramadol before? Tramadol, the anti-pain. No, Tramadol. Yes, that can make you have the brain fog too. The sleeping pills, and the antihistamine, histamine. And some people have a metabolic disorder such as the thyroid, abnormal thyroid function, or B12 deficiency. The B12 deficiency, it will be happen with you have the problem with your stomach, or you have a lack of some meat. Maybe you have to eat more meat, and B12 will not deficiency. And you have something that chronic inflammation. For my examination, examples such as if you have the tooth problem, you have the chronic inflammation. It can make the brain fog, and also it can make the stroke too. And some patients have a dehydration, and again, sleep disorder. I have one of my patients have come to see me with the dizzy and diagnose. Dizzy all the time. Everything work up is normal, but sleep test is abnormal. And that's why he has dizzy. Mostly it's for the people who have the sleep disorder. I mean sleep apnea. We have the like a dizzy in the morning time, and have like me now, word finding difficulty, and have like a not good memory, and have a daytime sleepiness. But I have not daytime sleepiness, I have all-time sleepiness. Okay, that one is not for the pathology. We have to compare about something have a problem and something not. The attention and the anxiety is not much the problem, because we can treat and we can prevent. The brain fog too, we can prevent. This one we talk about the pathology. The pathology of attention and anxiety means something that make the brain not function, make some abnormal or imbalance of neurotransmitter. The brain fog is mean like a cytokine mediated. It's hard to understand. I think it's like something that make your brain have inflammation, and after that, but brain barrier have not the good function. But the real problem is this one, the MCI and dementia. The MCI is mean my cognitive impair. This one is a problem. The MCI and dementia, that this is the real problem, because it's from the organic, from your brain problem. It have like garbage in the brain. Garbage is mean amyloid beta and tau protein. It have the garbage, and after that, the garbage cannot clear to your brain, and it make your brain have a neuron dead. After that, the brain is collapsed. like atrophy. That make you have like a memory loss, and it cannot reversible, but it can slow progression. For this one is the group of the brain pathology. For my cognitive impairment, how did you know? Maybe you need to do the we have the memory test. You have to do the memory test, but it's not the, we have the mild cognitive impairment and dementia. If mild cognitive impairment, you can use the daily life as normal, but you feel you forget something, but you have a little bit cognitive impair, but still have can use the daily life as the normal. And this is a cause of the cognitive impair. Had anyone have do the list of this one? The for the my cognitive impair, 10% per year is convert to the dementia. But some is remain stable and some is the can reverse to the normal. The prevention is the prevention and the monitor is the key. I mean about the Alzheimer, for the before I would like to tell you about the Alzheimer first. Some people have the symptom today, but the disease is happen for 30 years before you have the symptom. Maybe you can check for your blood test or something to check. In nowadays we can do that like that. This is the last thing and the real problem. The real problem now is called dementia. About the dementia, it's a progressive cognitive decline. Mostly not the patient tell, but who is the caregiver tell us that they have changed for 1 or 2 years for the cognitive. And after that, have some function impairment, such as if your wife do you cook for your breakfast in the morning time, and some have she cannot do for you, that maybe she has a functional impairment. But have to different from the delirium and the psychiatric illness. Some patients have the depression, and after depression, they have the cognitive impair too. Have to the diagnosis different. But for the type of the dementia, one, the most common is the Alzheimer's disease. The Alzheimer's disease. And the second one is the vascular dementia. For the Alzheimer's disease, now we have the medication for slow progression of the Alzheimer's disease, but we cannot cure, but it's have a good, because when I am the medical student, the people who have the Alzheimer's disease will dead in 10 years. But nowadays we extend more than 20 years. For the vascular dementia, it means like people have the stroke or mini stroke, and the stroke that affect the memory region in the brain. The symptom is like Alzheimer's disease, but it's not. This one can prevent, and this one can stop progression. The Lewy body dementia is like a Parkinson's disease spectrum. It's only 10%. And frontotemporal dementia is like a Alzheimer's disease, but it's another area of the brain, happen in the brain. And some patients have the mixed pathology. This is the things that I tell you, that something is happened for 30 years ago before you have symptom. It's called that the protein in the brain is called the amyloid plaque. It have the amyloid beta. It have the dysfunction for we have the DNA, right? DNA have to DNA in our body will encode to be the protein and cut the protein, and it have a dysfunction to cut the protein, and this produce the amyloid beta. It is not good. The amyloid beta and the tau, these are not good. The amyloid beta, that is, we can get rid of our brain by sleep. If we have sleep enough, the amyloid beta and the tau can get rid of from our body. But some people not. Some people have a lot of them, so we cannot get rid of them all. That's why in that people we have they will have the Alzheimer's disease. And after it have the more up to this one, is caused the neuroinflammation, because in our brain we have the cell that can eat the abnormal, and after eat that is have the cause the inflammation. After cause the inflammation, like we have the inflammation, some cell will dead there, because the inflammation kill the cell around there. That's why we have the neuronal death. After neuronal death, that we have the bad memory. For the neuron, in our body, we have a build the brain, right? And after 5 years old, the brain will not grow up. It's only that. It cannot repair. If it can repair, it's very slowly. That's why the patient who have the stroke cannot recover if he have the last stroke. If the patient have stroke, so the stroke will be there. But some patient can recover because another cell can work replace the area of the stroke, but it cannot repair the brain cell. This one is another cause of the dementia. We call the vascular. Do you remember that I tell that it's one kind of the stroke? We call small vessel disease. It means it's small artery occlusion in your brain. You will see like this. If you do the MRI, you will see like this. And it's caused by hypoperfusion. It means that low blood supply to your brain. It's caused, the risk factor is a hypertension. Someone have hypertension here? Oh, you have a risk, right? Someone have diabetes here? Oh. Someone have hypercholesterol here? Oh, I think someone. Atrial fibrillation. I miss someone have atrial fibrillation. And do you smoking? That is a risk factor for the memory. Very dangerous. So but for the hypertension, it's most important because it's number one risk factor of the stroke. But the hypertension, if you can control, you as the normal people, no risk. If you have diabetes and you have the good control, you have like a normal people too. And if you have the high cholesterol and you under control, it's like a normal people too. And if you have the AF and you take the medicine, you as the normal people too. So everything you can control. This one is the dementia risk factor for the study of Lancet. Who have a physical inactivity? Anyone? Smoking? Excessive alcohol consumption? And any German guy here? Because I have the patient who be the German guy. He told me it's not the alcohol. The beer is not the alcohol. The beer is the water. It's a German water. Is that right? You agree, right? Air pollution. And head injury. Some patients have head injury and he have a neuronal loss that have the risk factor of the dementia. And unfrequent social contact. Don't live alone. Live with someone, please. Less education. Obesity. Have to use can you calculate the BMI? If your BMI is more than 24, have a high risk. So I have more than 24 before. Now I am 23.9. Okay, I'm safe now. Hypertension, diabetes, depression, hearing impairment. If you have the hearing impairment, if you use the machine that help to hearing, it prevent the dementia. High LDL cholesterol. LDL is we call the bad cholesterol. If you have high level, you have the risk for the dementia. And vision loss is a high risk for the dementia. Who have more than three risks? No. Okay, good luck. Okay, the strategy to prevention. You know, for my opinion, when I do the slide, I cannot do it too. Okay, don't be worried if you cannot do it, but I would like you to try to do it. Exercise more than 150 minutes per week. And anyone can do? Really? Very good. Mediterranean diet, not sometime. I think it's okay. I like to eat salmon. And cognitive and social engagement like this. You have to someone who make a meeting like this, that very good to prevent the dementia. Sleep 7 to 8 hours per night. Can you? Okay. Stress reduction. I think you have no state here because I think Pattaya is a happy town. Blood pressure less than 140 and 90. Diabetes control. Statin, if you have the high cholesterol. For the statin, it have the lot of the paper of the statin. I don't want to discuss here because some paper tell it good and some paper tell it not good because it reduce both of the bad and good cholesterol. But by the way, because I am the stroke specialist, I suggest I would like my patient to take the statin because I believe in one paper because it's lot of the participant. It note that the patient who have the cardiovascular risk take the statin have a lifelong than the people cannot take for 2 years. That's why, okay, I give my patient for the statin. And the patient who have the AF, atrial fibrillation, take the anticoagulant to prevent too. For the diagnosis. If you cannot reach the 11 words that you can think of, or you cannot remember the lake, the mountain, and another one? Okay. I have the problem, right? You have to do the test. This is for the history. We have, when you go to the hospital, we have to ask you this one. Have something abnormal, you take many medication, or you have the cognitive something decline, or you have the family of history, because the Alzheimer is have the like a family history too. And we have the cognitive assessment too. We call the memory test, lot of the memory test. maybe I have the memory abnormal today because my verbal is not fluency today. And for the things that I test you from the start, we call that like a mini cog. If you cannot remember 3 words, please come to see me in the hospital. For the lab for workup, we have to use the lab for workup like this. This is the lab workup for the cause of the dementia. It reflects that what is the problem can make you have the memory problem. If we have find the cause, we can reverse the memory. That's why it's important that if you feel you have the memory problem, you would like to, you should go to the hospital because we can treat you or we can prevent the memory loss for you, and we can slowly, if you have the real problem in your brain. And we have after that, we can do the neuroimaging to know that what exactly happened if you have the memory loss. And than that, we use the PET scan. If do the PET scan and see the amyloid or tau protein, or we will know that, okay, you have the Alzheimer. But for the MRI, in Bangkok Hospital Pattaya, we can tell you the volume loss of your brain. If you do the MRI today, you know your volume of your brain, right? After that, for 3 years or 5 years, you can do it again, and you know how many % of the loss of your neuron in your brain. It can tell you as the volume of the brain that lost. And it can tell the volume of the hippocampus that is the cause of the Alzheimer's disease too. This is how to treatment of the Alzheimer's disease. This is the medication to help. Like I tell the patient that have Alzheimer's disease, it means like if you sit in the room like this, but the sound have less, you cannot hear it. It's 2 things that it's not loud enough, and or it have some environment sound, right? The medication is make the sound is louder and make the environment quiet. And this is the new medication. For the Alzheimer's disease, it can slow more than the oral nowadays. We have the more slow progress medication for the Alzheimer's disease. But we have the alternative adjunct for the treatment. This one is a neuroprotective peptide. For the peptide, I heard a lot of the peptide in TikTok. Some is not for the FDA approved. This one for the FDA approved, and it's the medication. I cannot tell what this is, but I mean, for the medication in Thailand, cannot tell that the medication that good or not. But some patients who have the dementia or have the stroke, we can use this one for help, like a stroke recovery and the dementia that come from the artery, the recovery. And modulation, we call the TMS and TDCS. The TMS is the machine, use the magnetic to stimulation the brain. We can use for the patient who have the dementia, memory loss, but mostly I use for the patient who have the anxiety, cannot sleep, and depression, especially from your wife. And TDCS, is the same thing of the TMS, but use the direct electric. This one is use the magnetic, and this one use the direct electric. It's low cost than the TMS. If you want to try to like stimulation your brain, you can come to see me at the Bangkok Hospital Pattaya, the brain center. And the vitamin, lot of the patient ask me about the vitamin. B12, folate is a folic acid, the same one. You need if you deficiency, but if you not deficiency, okay, you don't need. Vitamin D, you need if you're deficiency, and lot of the people in Thailand have the deficiency of vitamin D. For the Thai people, but I'm not sure because you have the sun bathing, right? I think you have no deficiency, but for me, for myself, I have the deficiency because I not see the sun all day. Omega-3 is good. This is very good. And the magnesium, zinc, if you have the insufficiency, you need some. Magnesium is good for the sleep, good for the muscle relaxation. This one is in the experimental is stem cell treatment. We cannot for the brain it cannot have a new neuron, right? We put the new neuron from another one to you, but not used for the nowadays. It's experimental. So today we know about the my cognitive impair is intervention window. I mean, if you have the my cognitive impair, you need to see the doctor because it's a junction that you go to the Alzheimer or you have a reversible. The vascular health is brain health. If you have do something good for your vascular, it's good for your brain. The lifestyle, as I told you, is to have a good therapy and it's good for the prevention. Prevention is good than treatment, right? Okay. This one for the future is okay. I have to talk about the gut-brain axis. If take something good, it have the gut-brain axis. So for the brain problem, something is from the gut, such as Parkinson's disease. Nowadays we know this from the gut. Okay, this is second message. Okay. Memory problem is a spectrum. Something can reversible, something can prevention, and something can treatment and slow progression. Prevention is the most powerful, right? And early diagnosis improve the good outcome. If you have early diagnosis, you can slow progression. And if you have the early diagnosis, you can treatment that. Such as the problem that usually happen is a sleep problem. If you treatment the sleep problem, about the brain have a very good condition. So for the who have the snoring, I would like you to see the sleep doctor. I think it's helped too much. Because if you have the sleep apnea, it's very easy to be the dementia and the stroke. And standard therapy is it helped too much for the patient who have the memory loss. Okay. I think we have over now. This is for the reference of the paper that I talked today. Okay.
This is a great talk, so thank you very much for that. I have two questions. Thankfully, I remember the first one when I put my hand up about 30 minutes ago, which was, I was surprised to see that chronic headache was not on that list.
Chronic headache, right?
Yes, because so many people suffer from headaches daily.
Can I
migraines and such? Yeah.
Migraine? Have to ask that. I have the lot of the patient come to see me with headache. But I'm not headache specialist, but the nurse have to send you. She like to send the headache patient to come to see me because most the patient have a muscle strain on the neck.
And then my second question relates to, we know from muscle that if you don't use it, you lose it. I also wonder if this really applies to some of the issues with memory as well. Now, I realize the pathology and so on that you're talking about, but I still think you have to use your brain, and there are probably certain exercises that can help you with short-term memory loss. Because my understanding is Alzheimer's.
We will show you after this. We will show you the exercise after this. But I would like to talk about the headache. If the headache, mostly, if you feel like a tension or tightness or have a pressure in the brain around frontal area or temporal area or neck around here and a little bit here, that is a muscle strain. You need to do the exercise, stretching exercise, or do the physical therapy. Or if it's not better, come to see me, please. And for the migraine, if you have migraine, the migraine have a typical, have to only one side of your head. If you have the bilateral pain, it's not the migraine. The migraine happen only one side of your head. And the pain character is the throbbing, like your heartbeat, tup, 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 like that. And it will happen about 4 hours, and it will have a better after you sleep. That is the migraine. But if bilateral is tension pain, no, you have the muscle problem. And mostly you have the muscle problem because you have the, like this on the social media. Me too. And I have to tell you the red flag of the headache. If you have the symptom like this, you need to see the neurologist as soon as possible. One is the most pain in your life, and it happen immediately, like very pain in your life that you need to go to see the doctor. The second thing, if you have the neurological deficit, such as abnormal vision, abnormal speech, you cannot speak as usual, have a numbness or weakness, or have the more dizzy and cannot balance yourself, that you have to go to the hospital immediately if you have headache. And the third thing, if you have the cough and it aggravate more headache, that you need to go to see the doctor because it have an abnormal pressure in your brain. Okay.
I remember when I was back in the UK that I would think of something I needed to do upstairs, and I went upstairs to do it, but by the time I got upstairs, I'd forgotten what it was. Now, that doesn't happen in Thailand because I live in a bungalow.
How can I tell?
I wanted to say that was a very interesting question about, hello, sir. That was a very interesting question about brain exercise and keeping your brain young, etc. There's some evidence that, for instance, one of the best things you can do to help keep your brain young is to learn a second language, almost at any age. So learn Thai. That'll keep your brain busy, and also things like crossword puzzles and stuff.
Yes, I think so.
Thank you, Doctor. Very informative. So a couple of questions. One, B12, it says something like plus or minus MMA.
Again,
a lot of people take B12, right?
Uh-huh.
But on your screen, it said MMA plus or minus next to the B12.
What does MMA stand for? MMA is...
MMI.
There it is, B12 plus MMMA.
MMA, yeah.
It has another thing about the...
What's MMA, I think is the question.
I forget now.
Mixed
what is that?
I love it.
I understand. I know what it stands for. It stands for mixed martial arts. Okay, that's MMA.
No, it's some derivative of the vitamin too.
the other thing, a lot of us, I mean, I take the vitamin B12, obviously. A lot of people do it. You recommend this, do you? Do you recommend vitamin B12 for everybody when we get older?
Only have if you have the B12 deficiency, you need to take the B12. But if you're not deficiency, no need to take the B12.
Right.
Take B12.
And is it good to take a multivitamin pill? Because I'm always I used to, then I stopped because I always tend to think this little pill with hundreds of things in it, does it work? I
understand that. So for my opinion, for B12, a little bit excess is not good. It's not have the toxicity. You can take the vitamin, multivitamin, but for the one vitamin that have to beware is the B6. B6 can do the toxicity with your nerve if you take it more. I have the patient who have the B6 toxicity and have a numbness and pain on the hand and feet. That is cause for B6 toxicity. You have to beware. But the multivitamin is not excess of the B6. It's okay. You can take it.
Yeah, for a while there was a trend against multivitamins, but now they've come back and said it's okay. Multivitamins are okay and they're good. But yeah, I take a multivitamin and some B12 as well. Oh, okay.
Okay, can you do
quickly? We'll get a microphone over to you. I'll repeat it. What does MMA stand for? Yeah, what he said. Methylmanic acid.
I don't know too.
I
have to accept that. I take from the lab in the hospital what the hospital can test you.
All
and
right.
and I know only if it's abnormal, it can treatable like that.
All right. You're next, yes.
Thank you, Doctor. Very informative. I have two questions. You mentioned later in your talk about hearing. My wife and I always seem to disagree on the volume of the television. She can listen to it at a much lower volume level. And even though I was a pilot and so on for 23 years, I think I still have pretty good hearing. As far as every time I go for a hearing test, they said, well, it's just fine. But this has to do with the level. And you said that there was some medication that might help correct that.
For the hearing?
To improve so I can listen to the TV at a lower volume.
I think it's not the problem. You can increase the volume if you go to do the hearing test. It's normal. It's okay. It's not the problem.
And just buy earplugs for your wife, okay?
You don't need
the earplugs.
No. You don't need the machine. Okay. I think it's okay. You just.
Second question is, I know I have a irregular heartbeat, atrial
fibrillation, right?
And you mentioned medication for that. I've been thinking about an ablation, but I would prefer a medicine. But the only medicine I tried several years ago gave me brain fog, and so I couldn't take that. Is there?
What did the medication make you have a brain fog? You cannot remember, right?
Well, it's been 5 years ago. And,
5 years ago.
Even though I was a chemistry major in college, the medical names don't mean much to me anymore.
Yes, me too, sometimes.
So that doesn't...
for the patient who have the atrial fibrillation or AF, if you go to see the doctor will have the risk factor, the risk, like the risk for the how many percent that the patient will go to be the stroke, and how many percent that the patient will go to be the bleeding risk. We have to calculate the risk. If your risk is too much to have stroke, maybe some doctor give you the anticoagulant or the blood thinner to help to not have the blood clot in your heart, and it can prevent the stroke.
All right, I've got one down here, Daryl.
Thanks, Doctor. That was great. Just referring back to Ren's and the gentleman here's comment before about certain activities like that we can do that can help. A friend of mine was a national chess champion in Australia, and he told me that amongst chess players, Alzheimer's is very, very low. Now, that's anecdotal evidence, but it's worth thinking about. If you want something to do to stimulate the brain, Ren says crosswords, chess is a good thing to play or learn. But I had a question. Is tinnitus a factor with dementia?
Mm-hmm.
Because a lot of people suffer from tinnitus.
If you have the tinnitus, I think it will that is very good idea. Very good question. If you have the tinnitus, you need to see the doctor to work up first that what happened and do the hearing test. If you have the normal hearing test, you use the hearing device, because if you have the hearing problem, it can make you have the memory problem in the future. First of all, test first what happened with you, maybe only the earwax. And the second, do the hearing test. If you have the abnormal hearing test, maybe you need the hearing device. Because I don't want, if you have the hearing problem, it will be the memory problem in the future. Okay. I like to play chess too.
Yeah, I agree with what he said about the chess thing. I think if you memorize stuff, like I'm in the process of memorizing right now, the Shakespeare To Be or Not to Be. I think memorizing stuff allows you to stimulate your brain. We also at the Writers Club write every 2 weeks. I think that's really stimulating, not only reading other people's writing, but doing some writing yourself. But the question I have is, I saw a study recently that talked about how much damage is being done to the brain by people spending so much time online and so much time looking at videos one after the other. And that actually deadens the brain and it allows it not to work as correctly. Can you address that issue and why that's so?
Yes, sure. That is we call the attention deficit. When you use the social media or TikTok clip, it make you have the attention deficit. And the one do you remember the one memory problem is the attention deficit that make you have the attention deficit. Is suppress your hippocampus. If you have that for a long time, your hippocampus will suppress for a long time. You will have the memory loss.
Yes, interestingly, in terms of memorizing things, if you memorize things just before you go to sleep, you tend to remember them better. And of course, what's happening with these people who are just absorbing things all the time, lots of their brain isn't getting used, right? So it needs exercise. Okay, question here.
Hello, doctor. I just read about a habit that most of us are doing, and this is no speaking. And this seems to be very dangerous for the brain, for Alzheimer, for dementia, because you can have minor injuries. Also, when you take out hair out of the nose, you can have minor injuries, and then you get bacteria, and this go very quickly to the brain. So I just read about this, so I don't know if you can confirm that or you read about this.
You mean you have the infection before and after that it go through your brain, or have a...
That's one of the questions he has, yes. Can infections go from, say, your nose into your brain and affect your brain badly?
I think if you have the infection in the area of your face, it's easy to go to the brain. And if you have the infection in your brain, it will have your brain is not good as before. Maybe after the treatment, it's have the not good as before.
Thank you for the talk. I have two questions. One is about when you were talking about brain fog.
Yeah.
I think you said something about if you're sleepy during the day. Is that even if you have a good night's sleep and you're still sleepy during the day? What can cause that?
You have the good sleep in the nighttime, right?
Yeah, well, I don't know. I really wonder how many people actually sleep 8 solid hours without waking up even once.
You have to do the sleep test. That you have the good sleep, but maybe the sleep is not in the good quality. Maybe you need to do the sleep test if you have the excessive sleepiness in the daytime.
I'm sorry.
So you have excessive sleepiness. How much? We say you're sleepy. How long do you sleep? Because there's some evidence Everybody experiences a sort of energy dip just after about midday. That is normal. Even people think it's because I had lunch and I get sleepy. This is not true. Even people fasting have an energy dip, just say after about noon. So, and they say that like a 15, 20-minute sleep is one of the best things you can do for yourself in the early afternoon. So that is that is normal, okay? But if you like sleeping for a couple of hours in the afternoon, that's not normal, okay?
Okay.
Does that help you with your understanding?
Yes. Thank you. One other question. You mentioned something about like a tick, tick, tick. What if you sometimes feel like you can feel your heart beating in your head just for 3 or 4 beats?
It's all the time, or it's come and go?
Just not very often, but every now and then.
It can be happen if your artery is near your ear, and it can happen when you have a little bit high blood pressure. But if you're hearing all the time, you need to see the doctor, because we can have the situation called the artery, the cerebral artery aneurysm, that is very dangerous to get bleeding in your brain. If you hear like a heartbeat all the time in your ear, that you need to go to see the doctor. But if come and go, it's okay. Maybe you have like a transient blood pressure, high blood pressure. Maybe you need to check your blood pressure.
Thank you.
All right, over here again, Michael.
Yeah, just the doctor and I were talking earlier about atrial fibrillation, which this gentleman was talking about, David. We talked about Xarelto, which I think is a very good. Well, I'm on that pill. It seems to be a very late newcomer, and as you say, should prevent you from having a stroke.
Prevent the stroke, yes.
So
70%.
They will tell they can put you in touch with Bangkok Pattaya Hospital, would probably. But other doctors, have recommended this Xarelto, and I think it's a wonder drug from what I hear, and keep my fingers crossed that it is.
I wanted to really acknowledge you for mentioning the gut-brain axis. This is really new and strange knowledge that probably we didn't see coming. The relationship between good gut health and good brain health. I recommended in the past, get onto kefir, really look after your gut health. And I became friends with this woman, or more than friends actually, and she had a kid with, Down syndrome, and anyway, I did and he ate terribly. All he would eat is like fish fingers, basically. That's all he would eat. And I thought his gut health must be terrible. And I did some research on it, and they did some research on it, and they discovered that they put these kids on fecal matter transplants. This is a big emergent thing in medicine, fecal matter transplants, where they take fecal matter from healthy people and put it into the guts of very unhealthy people that might have some chronic infection or something in their guts. And they can do it with tablets as well. Anyway, and it's turned around some people's health enormously, and there's some people get into self-administration where they actually harvest good feces from one person and put it in a blender and then, self-inject, as it were. But you can actually take pills and put it in, sort of dehydrate and put it in pill forms, and they put it on these like Down syndrome kids, and there was a 40% improvement in their symptoms just from this. That is unbelievable. That's like miracle level, right? So gut health and brain health, very strangely interactive.
Yeah.
I'm first, John.
I've got one.
Just as a point of information, in medieval times, people would sleep in periods of 4 hours and then wake up, have something to eat and go back to sleep again. It wasn't normal for people to sleep 8 hours a night on one go.
I think if you wake up for only 1 or 2 times, it's okay. But if many times, every hour, it's not okay.
Yeah, there's actually some evidence about after a certain age, split sleep becomes natural, where you sleep for a couple of hours, wake up for a couple of hours and go back to sleep. So there's a really good guy, Matthew Walker, he's a world sleep expert. It's worth, he did a brilliant interview with Joe Rogan that's worth checking out, actually. Sorry, I'm talking too much. Here you go.
Thank you, Ren. Doctor, can you hear me?
Yes.
Okay. I have a condition called small vessel disease of the brain.
Again, please.
Small vessel disease.
Small vessel disease, yes.
Cerebral small vessel
Yeah.
disease.
I know that. Okay.
Yes, and also a cavernous malformation. So I'm wondering if there's anything I can do about that. It
If you
affects
have
my
okay.
gait.
Okay, for the question is if you have you have the small vessel disease and you have to what you can do with them, right? The small vessel disease is like one kind of the stroke. You have to prevent the risk factor: diabetes, hypertension, lipids, alcohol, and smoking. If you control the risk factor, the small vessel disease is not progress. And after that, you need to check up for the risk factor for the risk factor of the small vessel disease maybe every 3 or 4 months, and after that maybe you need to do the memory test every 6 months to know that you have the problem or not. If you already have the problem, maybe you need the medication that can help about the memory. And you need to do another thing is you need to do the ultrasound carotid artery to do to check that you have some problem with the artery. If you have the stenosis, I mean, it's narrowing of the artery on your neck, maybe you need to solve the problem too.
Doc, thank you for a very informative talk, because a very comprehensive, difficult subject to understand. I'm still trying to figure out what my wife has got. Whether she's got brain fog or deficiency dementia.
Oh.
Because when she goes to the kitchen, make a tea or coffee, she often comes back forgetting to switch all the lights off. So I have to get up and go there. But when we go out in the car, she can remember every restaurant, cap and whatnot as we're going on. Absolutely amazing.
Oh,
I think that's not a brain disease. That's a woman's disease, right?
I think so. Oh, the most important for your life, you cannot forget your wife. If you forget your wife, it's dangerous for your wife, your life, right?
Okay. I have tinnitus. You know what tinnitus is, right? Tinnitus?
Tinnitus, yes.
You say it a little different?
Tinnitus?
Okay.
Tinnitus,
Yeah.
right?
Like right now, I have a very loud ringing in my ears.
Yes.
I have trouble understanding you. I have trouble hearing some of these people. And is there anything you can do about that? I've had it for 65 years, ever since I was in the Marine Corps.
Did you see the ENT doctor already?
No.
That you have to check with the ENT doctor first, and they will give you the hearing device, and it will help you hearing better.
Okay, thank you.
You're welcome.
I just want to share the acronym MMA after vitamin B12. That's methylmalonic acid, which if the drop in vitamin B12 is not very obvious, a small drop in MMA, methylmalonic acid, picks it up. It's just one way of discovering vitamin B12 deficiency before it's very advanced. Just that's what it stands for.
Oh, thank you. Oh, thank you.
Thank you, ma'am. I just had a couple question that I always wondered about. I had a couple of relatives that had dementia, and when we talked to them, they'd always go back to like their high school days to something. If it was something like, right now, they'd talk about like a relative that had passed away 10, 12 years ago. I never understood. Do you correct them, or do you just let them, go with what they think has happened?
You mean that about the high school and you mean the education and the dementia, right?
Yeah, trying to hold a conversation with them. They talk about someone who had
Can I give an example from my life? Okay. When we went my mother was in the assessment center. We went in, my brother and I were visiting, and she said, "Just take me home and I'll read books until I die." And she couldn't read a book because she couldn't remember what she just read, okay? But and I said to her, but I didn't say about the reading the books. I said, "Where's home, Ma?" and she said, Henty. She hadn't lived in Henty since she was 19. So they remember things from the distance past. They can't remember things 5 minutes ago.
Would you correct them or just?
Well, it's really, when you've got somebody
understood.
like that, what you're trying to do, and this is very important to understand, you're trying to support yourself as much as you're trying to support the other person. So, you know, my brother was there, and then he realized that taking her home to read books until she died wasn't an option when she couldn't remember what happened 5 minutes ago. So, you know, this is one of the things, if you want to support people, first you've also got to support yourself. It's really, really important takeaway, okay? And this is why one of the reasons you get professional help involved, so they can give you the options of how you help that person.
I mean, for the education, it mean like if you have it's like the memory in your brain, right? It's like a computer. If you study something too much, it have the area to preserve a lot of the area in your brain. That's why the patient, the people who have the educating many things, it can have the good brain than the people that not educating too much. I mean, if we learning too much, learning for the more language, learning for something that not in the school, so everything, the brain will like have something happen in the brain, have some memory, some practice in the brain, like your body. If you exercise every day, it will strong, like that. If you practice something every day with your brain, it make your brain have the preserve area for the memory.
Oh, one other example I just wanted to give. She mentioned PEMF therapy, pulsed electromagnetic field therapy. It's very, very powerful. Where's Sweeties? Where's the Sweeties guy? Oh, we've got one more. Where's Greg? Anyway, oh, there you are. You're hiding over there. Don't act innocent. No. Anyway. We had a friend who showed early signs of Alzheimer's, and he got him to hire a PEMF machine, right?
TMS, right?
Yeah, but what he said was, and this is interesting, is that, and he admitted he was showing early signs of Alzheimer's, which was great. He got the machine, but what happened was, in the very first treatment, it fixed up his atrial problem.
No, it's just adjunctive. To help to stimulation the neuron to work.
Yeah.
Like make the neuron exercise.
But it also stimulates blood circulation because it's a magnetic pulse, and most of our blood is it's got a lot of iron in. And so anyway, it fixed up his atrial fibrillation, and then his Alzheimer's symptoms went away. And one of the theories is because he was getting better circulation to his brain stopped showing the signs of Alzheimer's and deterioration. Sorry, one more.
Oh, I had a question about the exercise. What would be some of the best exercises to increase the blood flow to your brain, which perhaps would help improve?
It's have to think for the exercise. I mean to Kai, exercise for the body it helps too. Like I tell you that you have the exercise for more than 150 minutes per week. It helps for the body and the brain too. But for the brain exercise, such as the chest, press chest, use the crossword or something, that is very good. And the social meeting is very good for the brain too.
See, I think the memory of these people in this room is better than most people in Pattaya, because you guys actually know what day of the week it is. Go into a lot of bars, they won't know what day of the week it is, right? All right, well, that was such an unbelievably important subject. And we yes, we haven't finished, but I'll just make this presentation first. And no, I'm exercising your brains. Read it to me. It's upside down. Read it to me, okay? All right.
Thank you.
Thank you. That was fantastic. It's such an important.
Thank you.
Thank you so much. Now, even more exciting than this talk, if that's hard to believe, is, well, I'm going to let Kunji's introduce what happens next. Come on, Kunji. A round of applause. She's our link to Bangkok Pattaya Hospital.
If someone have a question and cannot ask here, you can add the line and you can ask the question in the line. I will answer by myself. Okay.
Okay. Before we start brain gym exercise, I would like to ask everyone a short question. Have you ever walked into a room and suddenly forgotten why you went there? Sure? Yeah, everyone? Yeah. Or when you would like to say something and after that the word disappear? Yes. Okay. Don't worry. It happens to all of us. Our brain needs exercise as our body. That's why we would like to show you the brain gym exercise today. Brain gym exercise will help to support your memory, improve your body coordination, or reduce stress.
Do they have to stand up? Should they stand up to do the exercise?
Yeah, you can sit.
Oh, wow.
Yes,
That's my
you
type
can
of
sit.
exercise.
It's just like a simple movement that help stimulation of your brain function. So let's wake up our brain together by brain gym exercise. Please give a warm welcome to Khun Mutta, our occupational therapist, who will be demonstrating the brain gym exercise for us today.
Okay, I am the occupational therapist. Today I will show you about for brain gym exercise. It's help for memory, concentration, and make decision. Okay. Exercise 1. You try to open your left hand like this, and then you do pronate for your right hand, and then you turn, alternate 10 times. 1, yes, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. And exercise 2. We cross the finger, interlace your finger like this, and then you straight finger up for the right hand, and then we switch to up like this. 1, 2, yeah, 3, 4, 5, 6, 7, 8, 9, 10. Okay. And exercise 3 นะคะ. You try to open your hand in front of you, and then you try to cross your arm and forming the thumb up like this, and then you try to switch. Are you ready? Okay. Like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay. And next.
Very good, student.
Yeah. And next is exercise 4. You try to move one finger on the right hand and 2 fingers for the left hand. And then we touch together. And then we try to switch the finger like this. 1. Yes. 2, 3, 4, 5, 6, 7, 8, 9, 10. We try to do it faster. for brain exercise. Yeah, like this. Do it faster. You can do. Okay. Okay. And exercise 5, we try to do the finger like this, L. And then we turn the hand, make a square like this. And then we turn your hand, walk up. Walk up like this, turn and walk up. Okay, we try to do 10 times. 1, 2, 3, walk up. 4, 5, 6, 7, 8, 9, 10. Okay. And exercise 6 นะคะ. You try to touch your tip finger with the thumb on the right hand, and then open your palm for the left hand, and then we touch together, and we make the left hand like this, touch the finger together, and then we switch hand like this. Do slowly first. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. We try to do it faster. Okay, do it faster. Yeah, faster, like this. Okay, ค่ะ. And the last exercise นะคะ we try to open your finger and touch on the tip finger like this. Touch together, and then we try to move circle, move forward 5 times like this. 1, 2, 3, 4, 5, and then we move backward. 1, 2, 3, 4, 5, and then we change finger for the index finger. Move forward. 1, 2, 3, 4, 5, and then we move backward. 1, 2, 3, 4, 5, and we change finger. Next is the middle finger. Forward. 1, 2, 3, 4, 5, and backward. 1, 2, 3, 4, 5, and then ring finger. It's very difficult. Okay. 1, 2, 3, 4, 5, and backward. 1, 2, 3, 4, 5, and the last finger, little finger. 1, 2, 3, 4, 5, and then move back. 1, 2, 3, 4, 5. Okay. Finish for exercise ค่ะ You can do it at home นะคะ for help about your concentration and your memory. Okay.
You can take photo. This is exercise at home.
I don't know about most guys here, but I think most women I've met really like guys who are good with their fingers. But this is the first woman who ever taught me how to be good with my fingers. Thank you. So, a really, really informative day at the club on such an incredibly important. Let's face it, what's more important than brain health? It's pretty much hard to think of anything. So, yeah, some really good things. And now we're going to have the Lucky Door Trot Prize, which I'm going to win, I think. I believe it's an airline ticket to New York, is it? What is it, actually? It's a one-way ticket, though, which I... What actually is it, really? What's the prize?
The price, we have two price. The first one is Bright Brain Checkup Package, which is the full comprehensive checkup package for the brain health to see if you have dementia or not. This one value of like 12,500 baht. And the second one is the test as well for the risk factor of the dementia. The test calledอะไรอาจารย์อันเนี้ย
Oligomerize the amyloid beta. If you have the risk for the Alzheimer disease, I have to tell about the package, that Bright Brain package a little bit. The Bright Brain package, it includes the MRI brain that I told you that we have to calculate about the volume of the brain, and the memory test and the blood test for the screening of the problem that possible. As for the example, the B12 level. Okay, for the lucky one, this is first or second prize. Second prize first. Second prize. This is for the oligomerized amyloid beta for screening the Alzheimer disease. Oh, number one.
Okay, thank you. Okay, so for the first prize,
for the first prize.
And the lucky winner is number 14. Who has number 14? They went home, okay. Okay, congratulations. And you can contact us for an appointment later on.
Congratulations, you will know the volume of your brain.